Okay, so this is the last exercise for the entire cardiovascular system. This time around, we'll be talking about pulse and pressure. If you're ready, let's go ahead. All right. So pulse are also known as pulse waves. They are formed as the heart pumps blood into the body. So in this image, we can see that the heart is pumping. So every time that the left ventricle pumps blood, it will go to the aorta. And from the aorta, it will go to the different arteries of the body. Once blood flows through the artery, it will cause a bulging of the arterial wall. Again, the strong blood flow from the heart will cause a bulging of the arterial wall, and that is what we feel as the pulse wave or the pressure waves. Okay? Now, if you noticed from your pulses, Doc, there are two beats that I feel in my pulses. That's because the first beat is the exact delivery of blood or bulging of the blood vessel by the delivery of blood, and the second one is just a reflected wave as the um pressure is returned via the artery as well, so that the beat becomes two. Okay, so that's your pulse. Now, the pulse matches the rhythm of the cardiac cycle, meaning every time we feel a pulse in any artery of the body, it reflects also the beating of the heart. So the beating of the heart and the pulse coincides with one another. And it gives us a lot of information about the cardiovascular system. So just this simple procedure, this simple maneuver of getting your pulse rate already tells us a lot of information about the entire cardiovascular system. So there are many pulse points in the body which you can use to determine the to get information about the cardiovascular system. I think the most popular ones are the radial artery, which is found at the bottom of our thumb here, no? So if you can put your middle and second digit, sorry, onto that area, you will feel pulses there. That's your radial artery. Another common pulse point in movies is the common carotid artery, right? When you try to palpate here at the bottom of the angle of the jaw, no? Usually in movies, that's where they palpate for the pulses. And when we get blood pressure, usually we use the brachial artery. Some other doctors would use the dorsalis pedis and even the femoral artery in very rare occasions. So how do we determine the heart rate or the pulse rate? First, we count the number of pulses or pressure waves on our desired pulse point. So you have to decide first which pulse point you want to use, whether it be the radial artery, common carotid, femoral, dorsalis pedis. Choose one and then put your middle and your index finger there and start counting the beats for a full minute. Let me just tell you that you cannot count for only 30 seconds and then just multiply by 2. That's not allowed. That's cheating. Nor can you use your thumb in determining the pulse because you might, instead of feeling the patient's pulse, you might feel your own pulse instead. So cannot use that. And not only will you take note of the beats, the number of beats, but you also have to take note of the strength and rhythm of the pulses that you're getting. Next, let's talk about blood pressure. So what is blood pressure? So it is the strength of blood as it is delivered by the heart towards the rest of the body. And we know that as blood flows through the arteries, it exerts effort or it causes a bulging of the blood vessel walls. So we want to determine how much pressure is flowing through the vessels, because if there's too much pressure, then it might cause the vessels to erupt, okay, or to explode in simpler terms. So we want to determine what is the current pressure of the blood as it flows through the vessels. The maximum value produced by a single heart contraction is called systole. And as you can see in this GIF image here, systole happens when the ventricles contract. So when the left and the right ventricles contract, that is the highest pressure. Okay? While the minimum pressure produced by the heart or during heart relaxation is called diastolic pressure. So when the ventricles are relaxed here, it's relaxed, it causes diastole, no? Ayan, relax yung ventricles, diastolic pressure yun. So how do we get the BP of a patient? First, we use a sphygmomanometer. And I have a sphygmomanometer here with me, which I love to show to you. So a sphygmomanometer before used to be a big apparatus attached to a liquid mercury manometer. But now we don't use the liquid mercury anymore. It's not allowed anymore by the FDA. But the unit remains to be millimeters of mercury or mmHg. Hg because the chemical symbol of mercury is Hg for hygrarium, right? So this is how a sphygmomanometer now looks like. So it has an arm cuff, my arm cuff. It has the dial or the sphygmomanometer itself and a bulb that you use to pump air into the air cuff. So this is how a sphygmomanometer looks like nowadays. So the measurement of blood pressure is based on your hearing of the Korotkov sound. Okay? The Korotkov sound it reflects the pressure inside the vessels, no? So the systolic pressure is the point at which the sound is first heard. So after inflating the bulb to a maximum, then you will not hear anything. But as you slowly release air, you will hear beats. And the first beat that you will hear is the systolic pressure. And the last beat that you will hear will correspond to the diastolic pressure. So how does this happen? So normally, blood is able to freely flow from the heart to the arteries. Once you apply the cuff and inflate it, it says here above 120. So any pressure above 120 will cause that artery to be occluded. Once there is no more blood flow, you won't hear anything on the stethoscope. So you have to slowly release air so that pressure will go down slowly. Once the vessel opens up, the arteries open up, it will cause pressure to produce a sound called Korotkov sound. The first beat that you will hear will correspond to your systolic pressure. And once the entire vessel is no longer occluded, the last beat that you will hear will correspond to your diastolic pressure. So let me demonstrate it to you. Okay, so I will demonstrate how to perform blood pressure. First, you have to open your arm cuff and apply it to the left arm of your patient. Usually, we remove clothing or anything that may hinder the determination of the proper blood pressure. So, just apply your arm cuff and make sure that you secure it by attaching the Velcro part. How will you make sure that the arm cuff is tight enough? You should be able to insert 2 fingers underneath. So if the patient says it's comfortable, is it comfortable, patient?
Yes.
So if it's comfortable, then it's tight enough. If you cannot insert it, it's too tight. And if it's too loose, you're able to insert up to 3 fingers, it's too loose. Okay? So usually we apply it 2 fingers above the antecubital area. Okay? And then you apply your stethoscope on the medial aspect. So let's say we have the stethoscope here already. Make sure that your bulb is closed. So you close the bulb. Okay? Once it's closed, inflate the cuff above 120. In my clinic, I usually inflate it above 200. So for this patient, let's inflate it above 200. Can you show it in front? So here, I'm not sure if you can see it well, but it's already at 200. Now, we slowly release air. Okay? So you will see the vial slowly going down. And you will start to hear the Korotkov sounds. The first sound that you will hear will correspond to your systolic, and the last sound that you will hear will correspond to your diastolic. So I just want to show you how the dial increases and decreases. So now I'm inflating it. There, now it's at 200. And then slowly we'll release air, and you will see that the dial slowly goes down. So the first beat that you will hear will correspond to your systolic, and the last one will correspond to your diastolic. And make sure you release completely all the air before removing the arm cuff from your patient. As you can see on your screens, these are the normal blood pressure values. I'm sure that your lolo or lola may have asked you before kung normal ba yung BP nila, and now this is your basis. So any blood pressure reading below 120 and 80 is normal. So 120, 80 below is normal. If the systolic is above 140, then the patient is already high blood or hypertensive. And or if the diastolic is above 90, the patient is already hypertensive. Okay? So that's it. Here are the lab reports you need to submit to me. 369, 370. Okay, thank you.